The liver is the largest organ in the abdomen, located on the right side of the abdomen, and it does about 500 functions in the body every day, some of which include bile production and secretion, excretion of bilirubin, cholesterol, hormones, enzyme activation, storage of glycogen, vitamins, synthesis of plasma proteins, metabolism of fats, proteins, and carbohydrates, to mention but a few. The inability of the liver to metabolize fats can result into abnormal accumulation of fats in the liver, causing what is known as fatty liver disease. Specialists in the field of medicine shed light on the disease.
So the liver has a percentage of fat that it should not go above, and when it's more than that, it's called fatty liver disease. There are generally two types of fatty liver disease. You have the one from alcohol and the one that is not from alcohol. So the one from alcohol is called alcoholic liver disease or alcoholic fatty liver disease. And the one that is not from alcohol is called non-alcoholic fatty liver disease.
So for alcohol related, it means that large amounts of consumption of alcohol can cause fat accumulation in liver. And the one that's caused by non-alcohol will include overweight or obesity. It can be caused by poorly controlled or treated diabetes mellitus. That is diseases that the body does not control the sugar content in them. Can be caused by drugs like steroids, can be caused by infections like hepatitis, starvation, prolonged fasting can also cause abnormal accumulation of fat in the liver.
Predisposition to fatty liver disease and major risk factors varies in terms of age and gender. Experts has this to say.
Okay, so it's called silent killer because in the initial stages of the disease, in the early stage, there are no symptoms. Or usually there are no symptoms. The symptoms typically occur when the disease is advanced in the late stages. So in other words, the person can be having damage to the liver and other tissues of the body without knowing. The person thinks he or she is well, is healthy. Meanwhile, excess fat in the liver is killing the liver and killing the person gradually. Non-alcoholic fatty liver disease affects about 25% of the adult population worldwide. So that's 1 in 4 people. So of every 4 people, at least one of them has non-alcoholic fatty liver disease. The first stage is fatty liver. Fatty liver as in this excess fat in the liver. That excess fat may not be damaging the liver. The second stage is when the excess fat starts to damage the liver, okay? What we call steatohepatitis. Then from that stage, the liver starts to respond to the damage caused by the fat and starts to get scarred, like when you have a wound and you have a scar. That is called fibrosis, and that can continue and cause liver cirrhosis. And in some patients, liver cirrhosis can actually lead to liver cancer. In some people, the liver cirrhosis can also cause liver failure, or what we call liver decompensation. So those are the stages that the patient will have symptoms.
Do Lagosians know about fatty liver disease, and of what importance is the investigation?
I have not seen anybody that has it before. I have not even seen one.
Yes, I've heard about it. And then we know anything that concerns the liver or the respiratory organ, it's something that needs to be taken care of.
Most times they don't know they have this illness. Some of them found them incidentally, or probably they go for an abdominal scan, investigation for something else, and they find out that they have fat in the liver. Or some have some complaints like pain around the liver that I've described, the right side of the abdomen, or they have abnormal tests that warrants the doctors to do more tests to find out that they have fatty liver disease.
So pain over the right side of the upper abdomen. They might have yellow eyes, they might lose weight. In very advanced disease, they might vomit blood, stool blood, or black stools. Their stomach may swell. Or their relations may notice that they are behaving abnormally, that maybe they're not sleeping as well as before, or sleeping more than before, forgetting things, they are confused, you are talking with the person, asking about issues in Nigeria, and the person derails and starts talking about something totally different. So confusion, memory lapses, but those, like I said, those are symptoms that occur much later. It's important to also note at this stage that non-alcoholic fatty liver disease has been associated with heart problems, okay? What we call metabolic syndrome and cardiovascular risk. So it's So in fact, people that have a non-alcoholic fatty liver disease, the commonest cause of death is actually not even the liver, it's cardiovascular. things like heart attack, heart failure, stroke, because associated with such cardiovascular or heart conditions and diseases.
There is an adage that says health is wealth. Therefore, it is imperative to identify fatty liver disease symptoms and its treatment. Fatty liver disease are becoming global health problems in adults as well as in children. Therefore, as humans, care must be given to fatty liver disease risk factors if you must stay healthy.